Chakka is in from CHI St. Vincent Heart Clinic, and today we're going to talk about maybe a term you haven't heard about before, syncope, and how it's sort of related to fainting. Good to see you.
Thank you.
Yeah, it's good to have you. What is syncope, first of all?
Syncope is a brief loss of consciousness. It can happen for many reasons. It could be very benign or serious. Common fainting is a type of syncope where people lose consciousness because there is some abnormality in the normal reflex that they have, and then loss of blood circulation to the brain and pass out.
So syncope is like the broader term,
Yes,
and fainting is a part of that? Okay, gotcha.
And a seizure sometimes could be confused with syncope. It's different. Seizure is a primary brainwave activity problem, whereas syncope is due to not having enough blood circulation to the brain. Okay. Sometimes people with syncope can have a little seizure-like activity because their brain is not getting enough blood circulation, but they're two different things.
Okay, let's talk about some of the causes then and how this could relate to your heart.
Something could be very simple, like sitting here interviewing with Melinda, and like suddenly you pass out because you're nervous on the stage, or some kid going on the stage and or it's too hot. They're very, very simple things that make people pass out. Those are not serious. Like somebody having extreme pain, or other situations like elderly people in the nighttime, especially after using the bathroom or getting off the commode, can pass out. Those kind of causes are not very serious. Whereas other ones where you can have either too slow a heart rate or a fast heart rate, that can make you pass out, and those are a little bit more, they need a little bit more attention.
Slow heartbeat or rapid heartbeat,
exactly.
both can be causes of this?
Yes.
Okay, something to watch for. Okay, and then when should you be concerned then?
What is it associated with? I mean, are they having injury? In what situations they're having? Are they having it when they're sitting? Or do they have any prior heart disease? Things like that would kind of dictate how serious it is and how much we need to look into.
So like a teenager who, like you said, maybe hits his thumb with a hammer and passes
Exactly.
out, not as much of a concern as someone, an older person who's had heart problems before. And then this has it been known to be fatal before?
There are some situations, yes. If somebody has a previous heart attacks and have decreased heart pumping function, sometimes they can have abnormal heart rhythms in the bottom chamber, can pass out and potentially die suddenly. Those can cause sudden death. But those are a small segment. I don't want everyone to worry that if somebody is having some fainting spell that they're going to die suddenly. That's a very specific population that we're talking about, where somebody has a previous heart disease or heart attacks, have had rhythm problems. That's a different situation, but can happen.
Right. Okay. And then which doctor would you go see? Would you start with your primary?
First one is a primary care physician. And important thing in fainting spells or syncope, history is the most important thing. What happened exactly when you passed out gives the doctor a lot of information. So if somebody witnessed your episode, take the witness to the doctor with you, and the primary doctor, based on their exam and the history, can decide whether you need to look more into a cardiac issues or neurological issues, the brain issues like seizures. So they can direct you which way you need to go.
So take a family friend or someone who saw you do it so that they can kind of tell the doctor what was happening. Good idea. I think it's good to take a friend with you anyway to the doctor so that they can get what you don't get. Let's talk about some of the tests for this. What would you run?
Sometimes you don't need any tests, like the kid who hit the thumb with the hammer and passing out. You don't need any testing. And reassurance and avoiding situations. Some people are more prone to that kind of fainting than other people. Precautions. And then other people may need an non-invasive testing like an EKG or an echocardiogram. Look at the structurally, if heart is okay, is the rhythm okay, things like that. Then there are some situations where we do testing like tilt table, which is not very helpful, but when things are not clear, in certain situations it may be helpful. There are more invasive tests where we go with the noodle-like catheters from the groin and troubleshoot the electrical system called EP study or electrophysiology study. There's a new kid on the block, which is a very tiny implantable loop monitor that we insert under the skin. It's a minimally invasive procedure. Sometimes in situations where it's very bothersome episodes and we're not able to diagnose, that's very, very helpful, whether if you're having a slow heart rate and pauses or fast heart rate, they can show, especially in elderly people who cannot communicate very well, it's even more useful.
It's amazing, the new advances and new tests that you have all the
tiny.
time. Exactly, amazing. Okay, I think we're going to have to stop it there, but if this is something that becomes normal in your life. You know, if you faint, it's not that big of a deal. But if this is becoming often, you might want to go have it checked out.
Oh, definitely.
Definitely. Here's the information on your screen. CHI St. Vincent Heart Clinic on Canis Road, and there's the phone number as well where you can call, and they will certainly set you up with one of the doctors there. But also think about your primary physician first and visit with them about it, and they can also refer you. Thank you, Dr. Chakka.